webinar should last no more than an hour, and we are hopeful to take some time and talk about the history of positive involvement in the HIV movement in terms of people living with HIV, in setting program, forming policy, and making a real difference. And to highlight some lessons learned, but to also share a new opportunity available to the field to further support positive organizing. For folks who have joined us today, if there are questions you would like to submit to the presenters, you'll see a box on the right side of the screen. That's questions for the presenters. Please do offer up any questions you have, and know that any questions entered there will only be seen by the presenters. There is also a chat box available in case you have questions or comments you would like shared with everyone on the webinar today. I want to start by doing an overview of today's webinar, and let me begin with introductions of our panelists, and I'm just going to ask if each one, after I introduce them, can acknowledge and make sure we hear their voice clearly. Let me start with Barb Cardell, who is an advocate and activist for people living with HIV. She is the vice chair of the USPL HIV Caucus and was a trainer and technical advisor for the Positive Organizing Project first round and lives in Colorado. Barb, do we have you today?
Yes, you do.
Thank you so much. Our second panelist today will be Benita. Benita Ray is the program coordinator of the Positive Organizing Project at the Legacy Community Health. She is a member of the Positive Women's Network USA and a community advocate. Benita, do we have you with us?
I'm here. Hello, everybody.
Hey, good morning, afternoon. Third, we have January. January Leo is the Director of Affairs for Legacy Community Health in Houston, Texas. She sits on the board for the League of Women Voters Houston and is an adjunct professor of the University of Houston Graduate College of Social Work. Welcome, January.
Hi.
Hi. And then last but not least with us today is Dr. Andrew Spildener, also known as Andy, who is a professor of health and culture at Hofstra University. He's worked previously with NAPWA, the Black AIDS Institute, the Latino Commission on AIDS, and currently serves on the leadership committee for the U.S. People Living with HIV Caucus. Andy, we got you with us?
Yeah, Michael, I'm here.
Thank you. So today's webinar, we hope to spend about 30 minutes that will cover some of the background on positive organizing work and meaningful involvement of people with HIV and the impact and why we believe it's so important. We'll tell you that we believe movements need not only be people living with HIV, and in fact today's webinar is 80% people living with HIV, but there are also non-HIV positive voice involved. But we do think that the meaningful involvement of people with HIV moves us towards more meaningful programs and more responsive policies. We will also talk from lessons learned from a effort called the Positive Organizing Project. Positive Organizing Project started in 2014, funded by Gilead to AIDS United, and then branched out to support 3 grantees in Seattle, Detroit, and Houston. We're going to share some of the lessons learned from that, and then look at moving forward as we issue a new RFP for competitive for applications to do positive organizing work in 2015. So with that said, I think we'll move forward to the first slide, and again, I will invite folks to offer up any questions to the question box, chat on the chat box, and here we go. Barb.
Great. Thanks, Michael. It's always important to define our terms when we start to talk about meaningful involvement. Oftentimes, we talk about GPA, which is the greater involvement of people with AIDS, and we actually call it the greater involvement of people with HIV and AIDS, and meaningful involvement of people with HIV and AIDS. GPA is often a global term, and MIPA has transcended into a term more frequently used in the United States. But when we are using either of these terms, what we're really talking about is the contribution and the involvement of people living with HIV as they determine policy, planning, budgeting, and programming in areas and aspects that influence their lives. And it really is important to know that this is meaningful involvement. so that when we talk about having people at the table, that they are both prepared to be at the table and that their voice is heard in more than a tokenistic kind of approach. So really what we need to do is that we are ensuring not just the passive recipients of services are parts of the program, but that we have the passionate advocates for the community there. Because as we engage people, we understand that they then develop their voice, advocate, and make sure that programming meets the needs of the people that they're trying to serve. MIPA, JIPA, and the meaningful involvement of people living with HIV has a really extensive history. It started in 1983 with the Denver Principles, and as I am a person living in Colorado, the Denver Principles, I think, have always been something I've found profoundly important, but I think that for most people living with HIV, when we talk about the history of our epidemic and the history of our people living with HIV, these Denver Principles that were created as an offshoot from a gay and lesbian health conference really form the beginning of the change of language. It used to be that people living with HIV were termed victims, that programs were developed for us, but by creating these principles that states really our Bill of Rights and our Declaration of Independence, it changed the face of healthcare and in particularly advocacy for people living with HIV irrevocably. And it's important to know that the Denver Principles have been used to shape other advocacy organization statements, and so they have used the Denver Principles as a basis to create a statement around mental health as well as some suicide prevention programs as well. But it does come back to 1983 in Denver when people living with HIV came together and refused to be called victims. And it's an important document, and I would encourage everybody to go ahead and take a look at it if you haven't read it already. Because back in 1983, and really through many of the early years of the epidemic, we didn't have much. We had our voices, and we could really stand up and shout for what we felt we needed when there wasn't a lot of medical intervention. And now that we have so much, it's important to remember that we do not want to lose the involvement of people living with HIV and the importance of our voices. Continues today. This is in 2012 for the International AIDS Conference in Washington, D.C. And again, people living with HIV brought their voices to the streets, demanding more modern engagement and involvement of people living with HIV in both the medicalization, the treatment, and the care, but also the policy and the planning. Positive involvement matters not just because it ensures that your programs meet the needs of people living with HIV, but it also ensures that people living with HIV feel as if programs that are created are responsive. And in the National HIV/AIDS Strategy, which was released by the national government in 2010, it explicitly calls for opportunities for people living with HIV to decide mechanisms for involvement, and we still need to leverage this for ongoing engagement. As we continue to look at positive involvement, we can go ahead and read this list and talk about how your programs can ensure the needs of people living with HIV. But really what we come back to is a statement that there's no liberation without community, and that involves our allies, not just people living with HIV. And that, again, one of our precepts from the Denver Principles is that nothing is done about us without us. And that is something, as we did trainings for the first Positive Organizing Project, we went back into communities and really shared that as an important need. How can people living with HIV be involved? Well, you'll have an opportunity to hear a real case study from Legacy. And we will also have Andy talk about how this can be implemented. But what we really come to terms with from the USPL-HIV Caucus is that people living with HIV must be involved at all levels, that they have an active role and that they are able to determine their personal health and wellness, make decisions for themselves, that we are spokespeople, that we advocate, that we are leaders, that we support, and that we are part of the program development and implementation. And this is also important to note that this includes that people living with HIV are part of decision-making bodies, that there are consultations that are held that specifically ask people living with HIV what their perspective is on new programs and even review of old programs, and that they give people an opportunity to have feedback. So I think that that's all a very important thing, and really as we come to understand the meaningful involvement, we really need to understand that, that by engaging positive voices, that we are allowing people to address their needs. And my final slide, of course, ends on Cesar Chavez, which is that once social change begins, it cannot be reversed. You cannot uneducate the person who has learned to read. You cannot humiliate the person who feels pride, and you cannot oppress the people who are not afraid anymore. And as we move forward into this exciting new era of addressing HIV, this is for people living with HIV as well as for our allies. And with that, I will go ahead and turn the presentation over to January and to Vanita.
Hi everybody, this is January in Houston, Texas with Legacy Community Health, and we received one of the inaugural Positive Organizing Project grants last year, and so I'm going to give you kind of a brief history of Legacy, why we feel that this project is so important, and then I'm going to hand it over to Vanita, and she's going to walk you through what we actually did with the grant money that we received. So for those who aren't familiar with Legacy, we are a federally qualified healthcare center. We've been one since 2007, but our roots are in the HIV/AIDS community. We started in the mid-'80s when the AIDS crisis was just beginning, and people, doctors, nurses, hospitals did not want to see people living with HIV. And so Legacy, then called the Montrose Clinic, was formed to meet that need. So we switched over to FQHC in 2007, and as of right now, we're one of the few organizations in Texas who are leading on HIV and AIDS policy issues. A big question that we get are, well, how did you get your leadership to buy in on something like this, to follow policy issues and to follow HIV advocacy? We have an amazing executive director, Katie Caldwell, who has been a part of this movement for a long time, has seen the progression, and has an almost preternatural sense for where things are going. So she's very much invested in this community, and because of that, we've been able to get buy-in from our board and from the agency in general. So what we've really, over the years that we've been doing this, organizing the HIV/AIDS community, we've really, obviously the community has to be involved in this process. Vanita and I can't be the only ones sitting around the table trying to represent all of Texas. So we began, trying to put our coalition together. And what we were finding during this process were two things. So the first thing is that there's really kind of a lack of understanding for how the various political processes work. And number two, people tend to only get involved when they feel like that something is going to have a direct and an immediate impact on their lives and the services that they receive. So out of that, we came to the conclusion that we need a system where we can identify, educate, and train the next generation of advocates to be active and involved in this process. And that's where our Positive Organizing Project comes in. So I'm going to hand it over to Vanita, and she's going to walk you through what our program looks like.
All right. Good afternoon, everybody. What I guess I want to show you first is just a brief timeline, a summary timeline of kind of a 6-month period in which we implemented the Positive Organizing Project and graduated our first class. And I think someone referred earlier to the training that was held in Washington, D.C. It might have been Barb. And that, for me, attending that training was a big turning point. I learned more about the Denver principles, MIPA and JIPA, and that really took hold in me and gave me a sense of, of how I thought that the program should develop. I came back from DC, revised our scope to kind of be more in line with community building and things like that. And then one of the, I think, first things and best things I did was hold a focus group with the long-term advocates here in Houston who are HIV positive and been out in the community 20 plus years, and sat down with them, explained the grant, and said, how should we do this here in Houston? And that was really big time for us because they bought in, they made suggestions, they became mentors, they became advisors, and they became our trainers, which is really powerful because not only do we have the next generation of advocates who are training, they were being trained by the long-term positive advocates who have been out there doing what they've been doing for a while. We ended up doing some community-wide training. The U.S. People Living with HIV Caucus came in and did a community-wide training so to prepare the broader community for the project that was getting ready to take place and to give them an understanding of what we're doing and why. And then we began to engage in our marketing outreach and our actual training sessions that occurred over a 6-week period starting September 30th. This photo is just from the community-wide training that the People Living with HIV Caucus came in and did for us to kind of, like I said, tell the broader community about what the Denver principles were and things like that, and about community organizing. One of the reasons this picture is significant for us is because every time that we get together, we bring some kind of advocacy to the table, and we had just lost a woman living with HIV who was killed at the hands of an intimate partner. And so we were still making a statement for Alicia Henson in this photo, and that's why people are holding pictures at the initial training. The purpose of what we decided the purpose of our positive organizing project was to build leadership in the community through these advocacy trainings. We hope that civic engagement would be increased, that we would create a network of support, and ultimately ensure access to care for folks. So getting people involved, helping them get trained, build skills and confidence, and really we began to build community through that was the goal, to build community through POP. The way that we implemented POP is that it's a 6-week advocacy training program designed by and for people living with HIV. That's a big deal for us. You know, not to say we don't appreciate our supporters and allies, we do, but this was a chance for us to build on those principles that Barb was talking about, the Denver principles of self-empowerment. How do we get ready and learn how to use our voice for change? And so we began to teach folks about leadership, community organizing. How do we get empowered so that we could speak up and share the information with other folks in the community? So we met once a week for 3 hours every Tuesday night. These are some of the subjects we covered. Again, most people who, like me, didn't know about the Denver principles in the beginning, so we started out with an overview for which the program was based on. The folks that I told you about that were in the focus group that were our mentors and trainers, they formed a panel that they talked about some of the challenges and the things that they had seen in the history of the HIV epidemic here in Houston, and some of the different ways that they had worked in advocacy over the years. It was probably one of the highest rated sessions we had. And then we went into a few other topics of, you know, ACA, community organizing. We had our technical advisor come in from the U.S. People Living with HIV Caucus, Vanessa Johnson, and did our leadership training, which was the second highest rated class that we had. We also were trying to teach people how to use your story to be more effective in meeting with decision makers. And again, we just learned a little bit about our HIV history, the history of the epidemic, the history of advocacy and activism in our movement. Oh, excuse me, y'all. This is just a shot from the panel of our mentors that spoke to the class, met with the participants outside of class. They were absolutely wonderful. To participate in our program, you had to be HIV positive. Our mentors in the focus group came up with required reading, the 4 agreements, which really folks loved, and one of the other programs here in Houston is now using as a part of their literacy program. We also, our folks had to agree to do some kind of advocacy project. It could be small to large, but what most folks did was attend Advocacy Day here in Texas, which is our version of AIDS Watch, where we went to the state capitol and talked to our legislators. They had to participate in community projects. Our mentors didn't want them to miss many classes out of 6 weeks. And as a way to kind of operationalize what we kind of interpreted JIPA to mean, being that our mentors and trainers were giving of their time and becoming our trainers, we provided a small stipend for them as a way to acknowledge their expertise in the subjects that they were training in. And then we provided mileage reimbursement for folks. This is a photo from our graduate class. We graduated 15 folks. We started out with 17 and we lost 2. What you see here is some folks, even though they want to be involved, are still not comfortable with disclosure and sharing their status quickly, which is fine with us. And so we had a way for them to still be in the picture and make a statement at the same time. At the end of the day, we outreach to, I know, over 350 folks. The radio, Facebook, talking to people, our mentors going out selling the program. We had 6 trainings. We graduated 15 folks. We volunteered at the food bank and the toy drive as a way to acknowledge we're part of a broader community and not just the HIV community. And again, we were part of the training, the community-wide training I talked about in the beginning. So what's still going on for us now is we created a POP Facebook page which we share information. Folks are involved in all levels of advocacy, and we use that Facebook page to share information, what you're doing, what you need help with. We participate in the World AIDS Day ceremony here in Houston. We actually drafted a proclamation that was signed by our mayor here in the city of Houston. Some of our participants have gone on to serve in the Ryan White Planning Council. We had a number of participants for Advocacy Day, and at least one of our participants attended AIDS Watch for the first time. So we're really proud of that. This picture is here because what happened, this is our POP logo, and those folks that were our mentors and stuff, they decided to come up with a POP logo, and they designed 5 POP logos, and our participants in the POP program selected the one that they wanted to use, and now it's on T-shirts and it's on some of our other things. So entirely community-driven. We love it. What's going on now is I am really knee-deep in the process. Oh, I just lost my, we're knee-deep in the process of designing our second class of POP. We're really excited about that. What I did to begin this was similar to what we did with the focus group. I called back all my graduates and my mentors, and let's say, what didn't work, what should we do different? And we had that meeting about 2 weeks ago, and now I'm in the process of redesigning that class. We're continuing to use POP. We meet on a regular basis here, once probably every other month, where we talk about the issues, get people involved, find out what they're doing. So we're determined to make this sustainable and being a part of a legacy that's helped too, so that we are continuing to meet. And those folks are going to be involved in the next POP class. The folks that were just graduated, we just had a really big community mobilization effort here to oppose a Senate bill here in Texas that was really about criminalization of people living with HIV, and our POP participants and our graduates really got involved and helped us in that effort, along with a lot of other folks, to oppose that bill. So we're continuing to work together, we're continuing to meet, and we're continuing our collaborations with other folks. And that's enough out of me.
Thanks, Monique. That's great. So my task is to kind of talk a little bit more about different ideas that you could do at your organizations around MIPA, JIPA, and positive organizing. So one of the first things to figure out is there's supposed to be a graphic there. So where are people living with HIV now in your area? And thinking about, are people living with HIV decision makers? Are we passive are we the targets for interventions? Are we asked to be speakers? One of the things to think about is that as someone living with HIV, I operate a lot of different positions all the time, and sometimes I don't feel like being a leader, and sometimes I do want to be one. And so it's my choice to do that, and I think that a lot of people living with HIV experience that we are on different parts of, that we are all at different levels of the community. So how do we measure engagement? One of the things I want to think about is, were people living with HIV part of the process? Are people living with HIV, are we active in the process? Why are we not? Why or why not? Also, when you think about your processes, your POP initiatives, think about how would it renew or mentor people? So how would people that have been at this for a while, how would their passions be renewed? And how do you mentor people that are new to the CIF process? I think that's one of the things that is important to think about, because you want it to be sustaining and in your area. Something to think about in terms of engagement is, did people living with HIV come up with the idea, or did somebody else decide, this is a great idea, this is what we need to do for people living with HIV, and this is what I believe the community wants? Because sometimes we don't know what the community wants, and that's okay, because we can actually find out. One of the things when you do a community assessment, and there's lots of tools to do it, lots of ways to do it, they don't have to be very expensive, they don't have to be a huge burden, but I think that community assessments are important. I think that one of the things to think about is think of the diversity in your community and make sure that you assess your community accurately. So if you have a large African American population, a large youth population, a large senior population, a women's population that is invisible, it's important to kind of really look at the nuances in your communities and involve people. You can do it through focus groups, interviews, surveys. You should also look at literature that's out there, either on government websites or the literature that's in research, or organizational literature. So things like, when was the last time your organization really involved people living with HIV? How is it handled? Is there a consumer advisory board? Are there minutes to it? Who's been involved with it? And look at those things to really critically reflect on your findings. When I say critically reflect, it should be uncomfortable. If you have a group of, say you've got a community advisory board and you're in a community that's largely people of color, but your community advisory board is not, then you should be uncomfortable with that finding, and you should think, well, why does it look this way? And challenge yourself to think of how to do an assessment that involves people. I want to talk about some other ideas before I get to stigma, but some other ideas, Vanita and January talked about advocacy. A lot of times there's a myth for nonprofit organizations that we can't engage in advocacy, but we can. We just can't, say that to go vote for this person or have, push one single legislation. But we can do, we're constituents for, elected officials, and we have the right to tell our voice and to do education on issues, to talk about what issues affect us, to talk about what issues affect our community. Coming up with the media campaign, I think we've seen a lot of media campaigns coming out of various government organizations. I have my own opinion about whether they're effective or not. Also, I think social groups are important. They have a purpose to kind of work on isolation. And I think that that's something that you saw with the Houston example, was that it was an advocacy group, but also that there was a social part of it, that people were able to build community and bridges. One of the interesting things is doing community work where people are public about their HIV status. So think about cleaning up a park, where you're wearing HIV-positive T-shirts. Michael led a group in Portland to do that. And I think it's a really exciting idea. So what about stigma? So stigma is complicated because it exists at personal, community, and institutional levels. And one of the things to think about when you're developing a stigma initiative is to really think about, where do you want to be effective? Are you going to affect people at the personal level, the community level, or the institutional level? I think one of the challenges with stigma is that generally people try to do too much. Like they think they're going to reach all those levels instead of really focusing on one or two levels. And what could that look like? One example would be the Stigma Index, which was developed by the U.S. people living with HIV. Global Network of People with AIDS. And the Stigma Index has been implemented all over the world. In one of the POP initiative projects was in Michigan, and it was actually piloting the Stigma Index in the United States. So the Stigma Index, basically people living with HIV collect the data, analyze the data, and interpret the data. So people living with HIV actually are trained to do the interviews with other people living with HIV and to look at how stigma is experienced in that community. So the example that's being shown right now is from Estonia. So if you look at these pictures, this is Estonia and Eastern Europe, and they found that people living with HIV didn't want to apply for work because they felt like they'd be stigmatized. They felt that there were no culturally specific services, and they felt that they didn't have a real community. So Estonia's people living with HIV group developed an initiative with employers to be open about encouraging people with HIV to apply to their jobs. They also helped develop HIV-positive-led health center, and they did a bunch of community leadership groups. So with that, some other ideas for greater involvement would be to look at employment practices and to make sure that there are key identifiable areas where people are encouraged to be out. And that's really important when you're doing this kind of work, to be able to have people, you know, whether it's developing a T-shirt or some other thing like that, these are important ideas. And with that, I think I've hit my time.
I think so, and thank you very much, Andy. Appreciate that. And I want to make sure the other presenters are hearing me fine as well. I'm going to take a few minutes. We're going to get in just about 4 minutes to the Positive Organizing POP RFA. I want to highlight something that I heard in Vanita's presentation, but also that Andy mentioned, which was about community building projects that aren't always specific about HIV. And in doing this, I first want to frame something. So part of, in my personal belief, what we're trying to get to in positive organizing is the recognition that stigma is a barrier that many have talked about for decades, but few of us have figured out how to get concrete on the response. We know concretely what stigma does. We know the reality that 1 in 5 Americans in 2012 were not comfortable working next to a positive person, and that 1 in 3 Americans in 2012 would not want a positive person taking care of their child, and that's a pervasive attitude in America that lets people living with HIV know they're not necessarily welcomed. And so the challenge then becomes, we also know we have 1.2 million Americans today living with HIV, 1.1 or a million who know it, and yet only 37% of all the people who are HIV positive in this country are currently on treatment. And in survey after survey, whether it's through the Stigma Index, whether it's through AIDS United studies on access to care, or whether it's other academic studies, we always find stigma among one of the top 5 barriers, meaning that, for example, at AIDS United on our access to care in a study of 4,000 people, between 15 and 30% of those people, depending on their city, said they didn't start treatment because they didn't want anyone to know their HIV status. And what we've learned from the lesbian, gay, bi, transgender movement, I think, is that you break down those stigmas by getting people to know other people with HIV. And so part of the positive organizing project efforts was, how do we combat opportunities? How do we create stigma? How do we create opportunities for people living with HIV to disclose their status, because we're not often invited as we walk into a room to say, if you're HIV positive, please feel free to identify as such, and there's not an invitation to share that status. So I wanted to sum that up, and I wanted to put one question to each of the presenters. I'm going to call you in order, and then we'll go into the RFP. And that is, I'm wondering if the presenters want to give other ideas or barriers that they think are key in terms of addressing and positive organizing. One concrete idea, if you had 15,000, of what you would like to do in your own community on positive organizing. And I am going to start, actually, with Barb, if I might.
Sure. So what I would do in my local community is that I would foster a group of people living with HIV coming together. In Colorado, we're pretty spread out, and so having an opportunity to come together, meet each other, and then be able to go out and build an advocacy platform, whether it's advocacy or even just being engaged as people living with HIV, I think would be important.
I think that's great, Barbara. And I want Andy actually mention the event I did in Portland, which was, we called it Screw Stigma, where we gathered 100 positive people who all put on bright red shirts that said Screw Stigma. But the gathering had nothing to do with HIV. It was a day of community service where all these people came together and said, we're going to do litter pickup and graffiti abatement. And it was not necessarily they wanted to focus on HIV, but they wanted to be with the community and show they could give back. And it was amazing to see how that translated down the road to people who were easily engaged in policy and advocacy efforts as well. Vanita, how about you?
Okay, I would want to host a community event as well, bringing together some of the folks that have been doing some of this stuff for a while, but we just haven't got together as a broader community to socialize for one, and then to maybe sit down and talk about some of the stuff. We have people prevention, care, and then we got our folks that are doing advocacy on their own. And I would love to build an advocacy community where we all had an opportunity in an event or something to build a bridge and to bring it all together. I don't see that happening a lot yet.
Thanks, Vanita. It is a real challenge in terms of the amount of isolation for so many folks living with HIV. January, any thoughts, concrete, you'd offer?
I think I would absolutely build on what we're already doing here in Houston. We have a great foundation going. What I would like to do is be able to get our advocates in front of elected officials on a more regular basis and take advantage of time in the district when you have more one-on-one time with elected officials, as opposed to during legislative sessions when things are just crazy and you get 5 minutes, 10 minutes with somebody tops. So, kind of breaking down some of those barriers and getting our advocates in front of our electeds.
Thank you, January. And Andy, last but not least?
I'm torn about that. I think I've lived in New York City for a long time. I just a couple months ago moved out to a suburb, so I'm putting both hats on. And in the suburb, I think visibility is really important. And I think one of the things that really stunned me, I went to a dentist out here, and I'm really nervous as somebody living with HIV about going to the dentist. I've had horrible experiences. And his brother had died of AIDS in the 80s, and so his entire staff is really, really educated on HIV and really cool about it. And they ask a lot of questions about meds and all that stuff, and it was really this kind of magic moment. And I would definitely do something here locally that's more community-driven, where the dentist and some other people could speak as well as people living with HIV in the community, because apparently there's a lot of us out here. And just be able to talk to the mayor and some community leaders about kind of what our needs are and what our experiences have been, to kind of politicize this small community around what HIV looks like and can look like.
Thank you, Andy. So thank you to the panelists for giving us some concrete ideas. Again, we often think about some of these things, community organizing and stigma, as very abstract concepts, but there's very concrete things that really make a difference in addressing stigma. And so I'm just going to take a few minutes to talk